First of all, I want to thank iCon-MESSSH’21 for inviting me to give a speech related on the Sustainable Development Goals. The Sustainable Development Goals are a universal call to action to end poverty, protect the planet and improve the lives and prospects of everyone, everywhere. However, COVID-19 has led to the first rise in extreme poverty in a generation. An additional 119-124 million people were pushed back into extreme poverty in 2020. The Deputy UN Chief said the COVID-19 pandemic has had a deeply negative impact on health and well-being, employment, businesses, incomes, education, and human rights, with a particularly damaging effect on women and girls. The COVID-19 pandemic is negatively impacting the European Union's (EU) progress towards achieving the 2030 Agenda and Sustainable Development Goals (SDGs), a 2021 Eurostat report has found. COVID-19 will likely shift from pandemic to endemic. Scientists predict that COVID-19 will become endemic over time. Pandemic disease. A pandemic is an epidemic that spreads across many countries and many continents around the world. Endemic disease is constantly present in a certain population or region, with relatively low spread, or there may be periods when it doesn't affect people at all, if it is only present in the environment. Death seems like it should be an accurate measure of the pandemic's evolution and effects, the worst outcome, an unequivocal outcome. Some experts who do not support the COVID-19 endemic idea usually have some misunderstandings. For example, A high infection rate will definitely lead to a high mortality rate. B. High vaccination levels can ensure that a country does not face a surge in high mortality. An article, Why We Must Not Allow COVID to Become Endemic in New Zealand indicate the Delta variant spreads ominously and without controls. Every infected person, on average, would infect 6 more than 36, 216, 1,296, 7,776, 46,656. We would get to more than twice New Zealand's 5 million with 3 more cycles. If COVID-19 becomes endemic, there will not be 1 or 2 people sick in a workplace or a home. Because too many people are sick. It will cost the world trillions when the healthcare system fails to accommodate the latest wave. More people will die. We do not care what the current strategy is called as long as we persist with border protection and public health measures until we achieve close to universal vaccination. Otherwise, many thousands of New Zealanders will be hospitalized, die. But real-world evidence shows that the United Kingdom and Japan are facing high infection rates but not high mortality rates. Japan's plummeting COVID-19 cases create mysterious success story. B. High vaccination level cannot ensure that a country will not face a surge in high mortality. Israel and Singapore send a signal to the world that high vaccination levels do not ensure that a country will not face a surge in high mortality and high infection rates. This shows that countries with high vaccination levels cannot be guaranteed to enter the COVID-19 endemic stage. Rising cases and deaths test Singapore's pivot to treat COVID as endemic. Singapore confronts the division and fear that come from living with COVID. Any country wants to enter the COVID-19 endemic stage. It is necessary to understand what are the main causes of high mortality and high infection rates, so that we can address them when they occur, so as to solve the persistent high mortality rate. Asymptomatic super spreaders with high viral loads cause high mortality, and high infection rates. The current strategy of testing only symptomatic close contacts in most high infection countries is wrong. This will lead to persistently high infections and high mortality, because super spreaders are usually asymptomatic high viral loads that have not been detected. This strategy will accumulate more asymptomatic super spreaders and cause persistently high infections and high mortality in the country, especially but asymptomatic patients have higher SARS-CoV to viral loads than symptomatic patients, and unlike in the few study in the literature, higher levels of SARS-CoV to plasma RNA had the strongest relationship with disease severity, key laboratory markers, and mortality. Examines the history of close relationships of diagnosed patients, detects 20 for non-symptomatic patients, and reveals that COVID-19 patients do not have symptoms that could potentially provoke others. The importance of this study is to know that patients with COVID-19 are not symptomatic, highly contagious, The duration of the infection may be 3 to 4 weeks, and that their infected patients may have severe disease. Studies suggest that the identification and isolation of persons with symptomatic COVID-19 alone will not control the ongoing spread of SARS-CoV-2 because asymptomatic to asymptomatic transmission was the most common transmission. Study conclude that the high asymptomatic incidence of SARS-CoV-2 infection in Bahrain and subsequent positive contacts from an index case were more likely to be asymptomatic, showing the high silent risk of transmission and need for comprehensive screening for each positive infection to help halt the ongoing pandemic. Studies indicate superspreading drives the COVID pandemic. Study indicate overall, there is substantial heterogeneity in the transmissibility of SARS-CoV-2 infection and therefore potential for superspreading with COVID-19. SSEs pose considerable challenges for local SARS-CoV-2 control as they can quickly overwhelm contact tracing capacity. Although most infected persons will generate few or no secondary infections, but a small fraction can generate many. Indeed, we observed that 19%, 15-24%, of cases were responsible for 80% of all SARS-CoV-2 transmission in Hong Kong, while 69%, 65-71%, of cases did not transmit to anyone. China and South Korea successfully controlled COVID-19 without a vaccine in 2020. Experts now believe that China and South Korea's strategy of testing everyone who has had contact with a patient, including asymptomatic, even if they themselves are not sick, asymptomatic, is more efficient at curbing the spread of the virus. The USA and European countries are only testing airport arrivals if they show symptoms. A study pinned down the source of the rapid spread of the coronavirus in China, people with little or no symptoms. The University of Colorado Boulder, where more than 72,500 saliva samples were tested for severe acute respiratory syndrome coronavirus to SARS-CoV-2, using qRT-PCR, found that just 2% of infected individuals carry 90% of the virions circulating within communities, serving as viral supercarriers and likely also superspreaders. Therefore, as long as we can track down asymptomatic superspreaders with a high viral load and institutional isolation them to prevent them from continuing to spread, we can reduce the high infection rate. The Lancet studies indicate the higher the viral load, the greater the transmissibility of the virus. Therefore, when a patient with high viral load, superspreaders, is identified, the implementation of reinforced contact tracing measures and quarantines might be crucial to reduce onward transmission. Peter Chu pandemic to endemic strategy will resolve all misunderstandings related to COVID-19 through science-based or real-world evidence. Do not know the real reason and draw conclusions. Usually those conclusions are untrue. Peter Chu pandemic to endemic strategy. 1. Peter Chu tracking superspreader strategy. 2. Peter Chu reduce the generation of new superspreaders strategy. 3. Peter Chu blocker strategy to reduce high infection rate. 4. Peter Chu nature immunization strategy for anti-vaccine group. 5. Peter Chu religion core strategy for religious believers. Method. Peter Chu's tracking superspreader strategy. 1. Tracing close contacts of virus carriers with high viral loads, such as those who brought in dead and severely ill patients. Instead of working forwards and finding close contacts who might have been exposed to a particular individual, backwards contact tracing follows the transmission chain back in time to locate the individual who infected the person in question. Akira Endo says backwards tracing can work pretty well as the final hammer to finish the outbreak. Manuscript leading respiratory China expert Zhong Nanshan said the new definition of close contacts for Delta variant. Close contacts should be defined as those who stayed in the same space, same unit, or even in the same building in the 4 days before the onset of symptoms. The backward contact tracing strategy and the new definition of close contacts China strategy can also be used to detect superspreaders. To early diagnosis of silent hypoxemia virus carriers by oximeter. Study indicate patients with silent hypoxemia do not necessarily experience any breathing difficulty, dyspnea, at the early stage of COVID-19 while the disease progresses. As a result, several asymptomatic, presymptomatic and patients with mild symptoms may escape quarantine measure and thus continue to spread the virus through contacts. Patients with silent hypoxemia are potential super spreaders. An early detection by oximeter is required in any store, restaurant and any public area. 3. Anal test. China using anal swabs for COVID testing. Study propose anal swabs as the potentially optimal specimen for SARS-CoV-2 detection for evaluation of hospital discharge of COVID-19 patients. Chinese scientists into a small number of COVID patients. In a few cases, people tested negative for COVID in throat and spit testing but tested positive with anal swabs. Li Tongzheng, Associate Director of Respiratory and Infectious Diseases at Beijing's Yuan Hospital, say applying extra anal swabs can improve the detection rate of infection and reduce misdiagnosis. High-risk people. Anal test to high-risk close contact potential super spreader, CT22, to reduce misdiagnosis. A negative pharynx 26 and sputum virus test may have a positive stool test. B. Travelers. China giving travelers anal tests for COVID-19. Travelers are a high-risk group because when they travel to a place, they usually don't know people with whom they are in close contact. Therefore, if they are found to be super spreaders of COVID-19, it is difficult to conduct contact tracing. In order to reduce misdiagnosis, travelers must perform pharynx and sputum virus testing and anal testing. 4. Wastewater test. Nature Biotechnology study. Tracking COVID-19 with wastewater indicate daily sampling of SARS-CoV-2 RNA and wastewater 27 would provide information similar to that from daily random testing of hundreds of individuals in a community, but it is more cost-effective and less invasive. Wastewater data could also be used to check the reliability of epidemiological trends calculated from diagnosed cases. Virginijus Sinkavicius 28, the European Commissioner for the Environment, said that monitoring wastewater can be a low-cost, but fast and reliable way to understand the spread of viruses and their variants among people. Result: Peter Chu pandemic to endemic strategy will resolve all misunderstandings related to COVID-19 through science-based or real-world evidence. Do not know the real reason and draw conclusions. Usually those conclusions are untrue. One of the main Peter Chu pandemic to endemic strategy are Peter Chu tracking super spreader strategy. The goal of Peter Chu's tracking super spreader strategy is to tracking asymptomatic super spreaders with high viral load and institutional isolation, reducing high hospitalization, high mortality and high infection rates without using vaccines. Studies suggest that heterologous ChAdOx1 COVID-19 and mRNA prime boost vaccination is an effective alternative to increase population immunity against COVID-19, including against the Delta variant. However, if some countries implement booster doses, it will cause vaccine shortages in poor countries. Therefore, Peter Chu's tracking super spreader strategy without using vaccines can be used for poor countries to prevent the surge of COVID-19, especially Delta variants. Conclusion: Singapore and Israel send a signal to the world that high vaccination levels cannot ensure that a country faces a surge of high mortality and high infection rates. The current strategy of testing only symptomatic close contacts in most high infection countries is wrong. This will lead to persistently high infections and high mortality, because super spreaders are usually asymptomatic high viral loads that have not been detected. This strategy will accumulate more asymptomatic super spreaders and cause persistently high infections and high mortality in the country, especially but. Peter Chu's tracking super spreader strategy aims to reduce super spreaders in high infection countries to ensure that the country's super spreaders are minimized. Therefore, the focus of this strategy is to first reduce hospitalization and mortality. After that, the infection rate will drop sharply. In addition, the practice of this strategy without using vaccine can solve vaccine shortages in poor countries' problem. Thanks for listening.